Limpopo Premier Stan Mathabatha is anxious about the number of COVID-19 infections at the mines. He says Sekhukhune only became the epicentre of the virus after the mines reopened. Now, the Premier has thanked the National Union of Mine Workers for giving him the heads up on the new infections. Now, for more on what the Premier said, we cross live now to our reporter, Hitekani Makwete. A very good afternoon to you, Hitekani. We see now that the Sekhukhune has surpassed Waterberg as the epicentre, and with the number of COVID-19 cases, and this due to the mines reopening. Give us a bit more insight as to what exactly was spoken about this afternoon or earlier on this morning.
Certainly, Tammy. In the beginning, for a long time, the Sekhukhune district was among the lowest districts in terms of the positive coronaviruses in the province. And ever since, as you rightly said in the intro, ever since the opening or the reopening of the mines in the province, the Sekhukhune district has surpassed the leading epicenter for the virus, which was Waterberg. That saw a very big reaction from the government, because we understand that the provincial government had been in communication with the mines for quite a while, and there was a disagreement in terms of, first of all, who should be quarantined. The provincial government wanted everyone coming back to work in the mines to be quarantined. The mines seemingly weren't quite happy about that, but it seems as if after the discovery of those 19 mine workers in the Marula mine, there was an understanding that the mines and the government came to in terms of quarantining and the type of measures that need to be in place. But the Premier spoke at length, and they emphasized a number of other things, as you will hear in this clip that we have for you.
For quite some time, Sekhukhune was at 0%. It was only after we opened, or we allowed the mines to open business, that Sekhukhune became an epicenter. And I would want MEC once again to thank the National Union of Mine Workers for warning us in advance that government, if you do this, then you must make sure that you do 1, 2, 3. And we did exactly that. Because had we not done that, had we not heeded the advice by the National Union of Mine Workers, I am sure that what is happening, there is one mine, I think it's West Deep Level somewhere in Gauteng, Carlton V, where they've got cases. I think in one day they've got something like 127 positive cases. Had we not taken that advice seriously, we could have experienced the same fate. But fortunately, we insisted with the Department of Health, the MEC and everybody there. We visited these mines and insisted that quarantine everybody who comes from outside the province, because we are sure that this area were at 0%. Remember, we launched a mass screening campaign.
Hitekani, come the 1st of June, we'll now be entering lockdown level 3. And so a lot of the restrictions that we experienced in level 4 and 5 would have been loosened. And that also obviously pertains to the mining sector. Given the number of cases that we've seen of COVID-19 within the mines so far, that have been running at 50% capacity, did the Premier talk about perhaps that being relooked? Was it a sense of concern for him?
Well, it was a sense of concern, and that's why he says his government has been interacting with not only the mining sector and the mines that are here in the Sekhukhune district mostly, but he's also been making sure that there is a kind of mediation between the communities that host these mines and the mines, because there was fears that there would be some kind of animosities that would build up, and then that would build up between the mines and the communities that would then sabotage the kind of measures that need to be in place to make sure that mines are able to fight the spread of coronavirus, given the fact that communities are supposed to be proactive in assisting the fight against the virus, even where the mines are concerned. But the other measure or the other Achilles heel or the challenge that's in place, especially with mines, is underground mining and the threats that come with the spread of coronavirus in underground mining. There are a couple of underground mines here in the province, and the Department of Economic Development here in the province says that they are continuously interacting and discussing the kind of measures that need to be in place and making sure that the mines themselves are not only talking about these things, but they're also implementing them at the respective mines. So quite a lot seems to be done. It seems to be the case that officials of the department are continuously on the ground, especially at mines, to ensure that there is testing, there is screening, there is social distancing, and there are some measures that might be helpful, especially in underground mining.
Where you at now, Itekane? There seems to be some testing going on there in the background. Give us some more details.
Sure, where I am, as you said, there is testing that's going on. This has to do with the what the province calls a monumental launch of a program that is aimed at ensuring that there is primary health care for communities. What the program entails, Tami, is that for one doctor, I'm going to try and explain this as accurately as possible. For one doctor, one doctor is assigned 10 nurses. Each nurse of those 10 is assigned another 10 home-based care worker. Of those home-based care workers, each one is assigned about 160 households to ensure that they give primary health care to. It's a kind of pyramid approach that weaves together primary health care resources to ensure that communities in each community in the province, no households go without a doctor and a person who is going to afford that household the primary health care that they need. This is, of course, in an effort to make sure that they find cases as soon and as quickly as possible to ensure that there is no rapid spread of the virus. This is, as per se, to try and nip it at the bud. But it's not only aimed at fighting coronavirus, it's also aimed at the other ailments as well. The test kits that the home-based care workers and nurses are being given are to test for high blood, to test for many other, including HIV. So it's a test kit for many ailments that many people might have. In fact, this afternoon when the MEC was here, she tested an individual from this household and found that her sugar levels were a little too high and alarmingly high, and she said that that person would then be referred to the clinic. So it's a kind of weaving together of the resources that the government has in order to make sure that no one is left uncared for and no one falls between the cracks.
Well, thank you so much for that update, Itekane. That's our Itekane Magwetse, who's out covering the cases of the mines. We do know that 19 mine workers were found to have contracted COVID-19. Obviously, a cause for concern, especially with us going closer and closer to the 1st of June for lockdown level 3.